Great. Thank you so much, Cameron, and thank you everyone for joining us today for our webinar. This is the National Alzheimer's and Dementia Resource Center webinar series, and today we're presenting Building Dementia Awareness in Tribal Communities through Interactive Programming, Implementing the Virtual Dementia Tour. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we move forward, I'd like to turn things over to Erin Long from the Administration for Community Living for a brief welcome.
Hi, everybody. I just wanted to thank you all for taking the time out of your busy days to join us for our webinar today. We're super excited to hear from Amber Hoon from the Great Lakes Intertribal Council and from Carrie and Lindsey from Oneida Nation to tell us about their experiences in implementing the Virtual Dementia Tour. Look forward to learning with you. With that, I'm going to send it back to you, Sarah, so we can get things started. Thanks again, everyone.
Great. Thank you so much, Erin. So as you heard, today's presenters are Amber Hoon and Carrie Lindsey. Amber Hoon serves as the Tribal Dementia Program Coordinator for the Great Lakes Intertribal Council located in Wisconsin. Amber is a certified trainer for the evidence-based Virtual Dementia Tour, and she has been trained in the Savvy Caregiver and Indian Country Training Program, Dementia Friends, and several other dementia-related trainings. Before her work for Glitzy, Amber enjoyed her 14-year career as a nurse on a special care Alzheimer's and dementia unit. Also with us today, we have Carrie Lindsey. She is the Long-Term Care Case Management Program Manager for the Oneida Nation near Green Bay, Wisconsin. Carrie is a licensed social worker who has worked with Native American communities for 26 years. She's a trained facilitator for the evidence-based Virtual Dementia Tour. At this time, I will turn the presentation over to Amber Hoon to begin. Amber?
Miigwech, thank you. Thank you to the National Alzheimer's and Dementia Resource Center and the Administration for Community Living for the opportunity to share with everyone today. Next slide, please. So this is a photo of our beautiful central office. We're located in Waskawaganning, Lac du Flambeau, Wisconsin. And I'd like to share just a little bit about Great Lakes Intertribal Council, also known as Glitzy. Glitzy is a consortium of federally recognized tribes in Wisconsin and the Upper Peninsula of Michigan. The organization was chartered in 1965 as a nonprofit, non-stock corporation under Wisconsin law and is recognized as a tax-exempt organization. Originally founded in 1963 as the Wisconsin Tribal Chairmen's Association, Glitzy's purpose was to provide a means by which member tribes could unite against the threat of termination and act as a mechanism for tribes to work through the challenges of governance and services for their communities. Today, Glitzy is recognized as a tribal organization under the Indian Self-Determination and Education Act. Its mission has evolved to support member tribes in expanding self-determination efforts by providing services and assistance. Organizational goals and objectives are established by our board of directors, which is comprised of tribal leadership, our tribal chairpeople or presidents, or his or her delegate of each member tribe. Each board member speaks for the interests of his or her tribe, and Glitzy's chief executive officer, chief financial officer, and staff members manage several programs in the areas of education, epidemiology, family health, nutrition education, aging, disability services, elder services, vocational rehabilitation, and economic development. Staff members are located at the central office and various tribal sites. Next slide, please. If you take a look at this map, this will show you some of our service area. The member tribes represent communities of Indian nations on 12 reservations, a combined American Indian population of approximately 40,026, and a land base of about 500,000 acres spanning 31 counties. Our member tribes are listed here on this slide. Next slide, please. So Glitzy's Together Strong Tribal Dementia Program is one of the programs offered to tribal communities through Glitzy. In June of 2020, Glitzy applied and was granted the Administration for Community Living's Tribal Alzheimer's Disease Program Initiatives Grant. I was hired on in August of 2020, and that's when the work began. Our work plan has 3 goals. The first is to introduce the evidence-based Savvy Caregiver in Indian Country program, whose principal author is Dr. J. Neil Henderson of the Choctaw Nation. The outcome of the program is to prepare families and friends for the role of caregiver and to increase their knowledge about the course of Alzheimer's and dementia. This promotes contented involvement for the person with dementia, which in turn can ultimately reduce caregiver stress. Our second goal is to offer the Virtual Dementia Tour to interested tribal communities and tribal staff. Glitzy did partner with the state of Wisconsin's Tribal Dementia Care Specialist to accomplish this goal. And finally, our third goal is to create a sustainable model for dementia awareness and education. Part of this third goal is accomplished by training the Tribal Dementia Care Specialists and other interested tribal staff as Virtual Dementia Tour facilitators and Savvy Caregiver in Indian Country facilitators. So they can continue to offer the VDT and Savvy Caregiver within the tribal communities they serve. The Virtual Dementia Tour, along with Savvy Caregiver in Indian Country, have become powerful tools in creating a better understanding of dementia within tribal communities. The focus of our talk today, though, will be on the Virtual Dementia Tour. Next slide, please. We have 2 learning objectives. The first will be that you will learn about some of the challenges faced when implementing training and/or programs within the tribal communities, and how veering away from the use of PowerPoints and lecture-based trainings has kind of had a positive effect. Our second learning objective will be to learn about the evidence-based Virtual Dementia Tour and its impact on tribal communities in Wisconsin. Next slide, please. We're going to start with the challenges of implementing some of the dementia programs in tribal community. I want to stress that the challenges listed here are based on my experiences and do not represent any particular tribal community. It's important to remember that every tribal community is unique. And for me, there's no one size fits all with the way that I approach things. The first 2 challenges that I listed are trust and time. I speak about these together because for me, they go hand in hand. In the beginning, the Together Strong program was a new program attempting to approach a very real, very sensitive topic, dementia in tribal communities. I asked myself how in the world I was going to start this program. I decided to do what I had been taught, and that was to listen and attempt to understand before opening my mouth. As soon as COVID restrictions started to lift, I attended any and every tribal outreach event that I was invited to. I set up my little table with my purple glitzy tribal dementia program tablecloth and put out some of the very limited tribal specific information that I had and a few other resources. And I sat and I sat and I sat some more. Then one day, a few months into things, an elder approached me. I happened to be at an elder meal site, and I went there to support a movie event that the Tribal Dementia Care Specialist in that particular community was doing. The elder came and sat by me and started off wanting to know who I was, where I was from, what I was doing there, where did I work, what was my job, did I have any kids, was I married? And then he started to talk about the food at the elder meal site and told me a little bit about himself. But then he asked, so what is this dementia stuff and why should I worry about it? This resulted in a 2-hour conversation about dementia, including what it is and what the warning signs are, and ended with the elder sharing that he had a couple friends that he worried might have dementia and wanted to know what he could do for them. He further explained that both of his friends lived alone and that he often checked on them. This was the beginning of establishing trust. The time taken to listen and learn was worth it. Yes, I ended up staying 2.5 hours past my shift that day, but look what came out of that. Trust was established. Going forward, I answered his calls when he phoned me and put together whatever information he requested, things like food and brain health, warning signs, risk factors, as well as common dementia behaviors. And guess what? Eventually, that same elder took me and introduced me to the friends he was talking about, and I had the honor of working with them. I would like to fast forward to a couple weeks ago. I was at a elder event here in Wisconsin, and I presented to a room full of about 50 or 60 elders from different tribal communities in Wisconsin. And that particular elder came up to me. He actually came to that presentation, and he approached me and said, "Now remember, I was your first #1 fan." And I can't tell you how much that meant to me. Another thing that I learned about time is it is precious to the caregiver and tribal staff. Often many hats are being worn, life is busy, work is busy, and there's often very little precious time to complete the things that need to be getting done, let alone add something else. I try to remember this when I'm scheduling a training or educational event. And I also offer go to caregivers' homes if that is better for them, just so that they can have that training and the things that they need. The next two challenges are terminology and content. There are many dementia training programs that are available nowadays, but not many that are relevant to our tribal communities here in Wisconsin, Michigan, Minnesota. If it's not relevant or relatable, honestly, folks are just not going to take the time, to attend. So during this project, a good amount of time was spent adapting and creating tribal dementia presentations and toolkits that were relevant to tribal communities within our area. Now, when we talk about terminology, I feel it's important to recognize the power of a word. They elicit emotions and various reactions and give us a form of communication. Let me give you an example. I was met with confusion about the term caregiver. It was explained to me that the idea of a caregiver was someone who was paid to take care of another person, a daughter or a son, a husband or wife, grandchild. They weren't considering themselves as caregivers and thought that the caregiver-related trainings weren't meant for them. In the beginning, I also encountered confusion when I presented the caregiver with a caregiver burden scale. The term burden just was offensive, and the questions associated with the burden scale were not relatable. I had to learn to pivot and pay attention to how I was saying things depending on who I was working with. For example, if I was working with a family member, I'd simply omit the term caregiver, but still go over the things that related to being a caregiver, like stress and burnout. And then working with tribal staff, where I would relay the same information, but could include the term informal caregiver. And finally, the term dementia was something that earlier in my work was not easily accepted or relatable. I had to approach things differently using terminology like brain health or aging well, and then slowly introducing dementia into the conversation. Currently, many of our elders and tribal community members have been seeking more information about dementia, though. So I'm kind of seeing a shift with the use of that word. And the term dementia is starting to actually be accepted and used more and more in conversations. So the final two challenges that I have encountered are transportation and privacy. Due to the rural location of many of our tribal partners, it can be difficult for caregivers or people with dementia and tribal staff to travel to attend training events. Partnering with the state of Wisconsin Tribal Dementia Care Specialists has been an amazing collaboration. Together, we were able to offer outreach and training in many tribal communities within Wisconsin, allowing more people to attend events and trainings by offering them in multiple locations at various times. The final challenge that I faced was privacy. And along with privacy, I kind of included participation. There were a few incidents when I or the Tribal Dementia Care Specialist would offer a group dementia training or event, and absolutely no one, not one person, signed up for that. When I started to kind of nose around and ask why that was, a lot of people mentioned that they just are not comfortable in a group. Some said they don't like sitting and have someone talk at them, and that they tend to just tune things out and not learn anything anyway. And some said they just don't want everyone to know their business. And yet some are still unsure about gathering, even to this day, in groups, after COVID. So for me, it came down to the question of how to get people comfortable enough and interested enough to participate. With Savvy Caregiver and Indian Country training, the ability with that was we were able to deliver it in the home one-on-one. But I felt I needed more, something different and interactive. So, next slide. This right here is finding the right fit, finding the right training fit. The various challenges that I had just mentioned, as well as the low response for group training from the community, led to the decision to find a training that was hands-on, engaging, but impactful. And that led us to the evidence-based virtual dementia tour. The first photo here depicts kind of how it felt when offering lecture-based training. The second photo is some of the tribal dementia care specialists actually taking the Savvy Caregiver in Indian Country facilitator training, which is very kind of lecture-based. But as you can see here, they're up, they're moving around. We have some good plates of food there. Part of this thing that I was trying to do is make things more immersive and interactive. So there was a lot of movement, there was a lot of engagement during this lecture-based training, which, you know, from the feedback from the tribal dementia care specialists really made it good for them. Okay, so this is going to actually bring me to the virtual dementia tour. After struggling to gain participation in lecture-based training, I was on the lookout for something interactive and different. A fellow ADPI grantee talked about implementing virtual dementia tour, and I really liked what I heard and decided I had to check it out. Next slide. So what is Second Wind Dreams Virtual Dementia Tour? The Virtual Dementia Tour was created by P.K. Beville, and it is a scientifically proven method of building a greater understanding of dementia through the use of patented sensory tools and instruction. Proceeds from sales of the Virtual Dementia Tour support the work of Second Wind Dream, an internationally known nonprofit dedicated to changing the perception of aging through the fulfillment of elders' dreams. If you're interested in learning more about that, their information can be found on the Second Wind Dreams website, and that website link is on this slide here. Next slide, please. So in a nutshell, this slide describes kind of what a VDT tour would look like. The VDT was designed to educate and sensitize healthcare workers, community members, and caregivers by simulating what is known about the effects of dementia on a person. I would like to mention that the simulation, it's meant to kind of mimic what it's like to have dementia in the mid to late stages, not the early stages. Participants complete a pretest, are specially garbed with sensory equipment, and then are asked to complete tasks in a specially prepared room in a certain amount of time. The garb and room are designed to simulate that mid to late stage dementia. After their time is up, VDT participants remove the garb, take a post-test, and are debriefed and offered resources and additional educational options to support them. That debrief is one of the most, you know, the experience itself is important, but for us as service providers, that debriefing is that educational opportunity when you can really connect with the participants and you know, learn how that experience was from them, and then offer them resources and education based on that. Next slide, please. We're now going to go into kind of Glitzy's journey with the VDT and how that all happened. Next slide. This slide's going to depict kind of the steps that Glitzy took towards implementing the VDT. Started out with researching it and just kind of seeing if it might be something that would fit well with our tribal communities. Once we decided that, yeah, this would be a go, then I went ahead and completed the online facilitator training through Second Wind Dream. When thinking about sustainability, it was brought up that it might be a good idea for Glitzy to go ahead and have me certified as a trainer. And that actually made a lot of sense when we thought about it, because if this program ever went away, we would have people set within each of our tribal communities that could continue delivering. So it's kind of a process. You have to fill out an application. and send in a resume, and then you get interviewed. And if all of that works out well, then you can go ahead and travel to Georgia and get your training. After that training, Glitzy engaged in outreach events within our Wisconsin tribal communities to kind of get some exposure as to what this is. And then we partnered up with our foster grandparent senior companion program and started implementation. Working with the Department of Health Services, Tribal Dementia Care Specialists, that has been very impactful and a huge piece of this whole virtual dementia tour experience within our tribal communities. We also garnered tribal leadership participation and support. And then I also already talked about that sustainability factor. Next slide, please. This is going to kind of show you just a little bit of our timeline here. I didn't get into too much detail, but as you can see in February, that's when I became that certified trainer. By February 7th, I came back and we, February 23rd, started training 4 of our Glitzy staff so that they could be tour guides to help volunteer to help with putting on the events. When we go to March, we can see that by the end of March, we had already delivered to 4 of our tribal communities. And then next slide. By May 11th, we actually offered our first virtual dementia tour facilitator training. And through that, we had 11 tribal DCS and other tribal staff, which included a social worker, aging director, administrative assistant, and occupational therapy assistant, trained as virtual dementia tour facilitators from various tribal communities. So now they were able to implement VDT on their own within their communities. We had approximately 27 Glitzy staff that went through the VDT experience as well. That was really, really a great experience for everybody. In June, we delivered VDT to 2 more tribal communities. July, we actually held an amazing youth event with the Tribal Dementia Care Specialists in the St. Croix community. And we were able to deliver a virtual dementia tour to approximately 40 youth there, ages 13 to 18, I believe it was. And again, an amazing experience. The youth really connected with the virtual dementia tour. There was some great conversation and learning that came out of that for both sides, for us implementing and for the youth. Okay. In August, we delivered to Great Lake Intertribal Council's Board of Directors, and that Board of Directors, as I mentioned earlier, is comprised of our tribal leadership, tribal presidents, and tribal chair people. We had about 11 of them go through, and that again, afterwards really opened up some great conversation and some really big understanding within our tribal leadership too. Okay. Next slide, please. February, we did deliver our second virtual dementia tour facilitator training. So that went really well, and we were able to train additional staff. Next slide. So basically, overall with the facilitator training, we have approximately 20 tribal staff in various communities that are trained to facilitate or offer virtual dementia tour within their communities. And we have delivered to approximately 200 community members and tribal staff. So they have been able to experience that virtual dementia touring and a better understanding of dementia and kind of what's going on for those people. Surprisingly, this was done in less than 2 years. So moving forward, it's going to be very interesting to see what happens when the tribal DCS really start delivering this. The end results, we've had some amazing community engagement and conversation. Tribal staff that have just been, you know, gaining much more understanding about dementia and what our our folks are going through that are living with dementia. The elder engagement has been amazing. The questions that are coming, their insight, their advice, things like that have really come out of this has been just wonderful. The youth engagement as well, questions that have come up from the youth, tribal leadership, their engagement, and just that excitement and that interest in holding future BDT events. Because one of the common things that I hear a lot is, oh my gosh, are you going to do this again? I have family that should really go through this. Or, well, you know, we have another department that would really benefit from experiencing the virtual dementia tour. So just that interest is really, really amazing. Next slide. What does the future hold? Well, most of the Wisconsin tribal dementia care specialists have now been trained to facilitate the VDT, and some have already started offering it within their tribal communities. So again, that's wonderful for that sustainability. Glitzy's been requested to offer a third VDT facilitator training, which we actually just completed. And that went really well. And we have 4 more facilitators to add to the list from that training. And also, Glitzy's been receiving a lot of phone calls to actually offer VDT in communities outside of Wisconsin, in different states, and also asking about possible facilitator training. So we'll see. It's a really been an amazing journey. And the acceptance from our communities has been wonderful and very insightful. So I'm really, really, really happy that we decided to take this direction and work with the Virtual Dementia Tour. Next slide. So I would just like to say miigwech, thank you. Even though I can't see anybody, it's been wonderful to be here and to kind of talk about some of the wonderful things that have been happening within our communities. That's all I have for you. Miigwech.
Carrie, on to you. We can go to the
Okay.
next slide.
Perfect. Next slide. Okay, so I'm going to talk just a little bit to piggyback off of Amber and what has the Virtual Dementia Tour looked like in bringing it to the Oneida Nation. Next slide. So the Oneida Nation is our program for our dementia care specialist is located within our comprehensive health division. So under that, I've shared on this screen just our vision, our mission, and our values. But we are a division of healthcare providers. We provide care for the Oneida Nation community, descendants, and surrounding tribes. So we don't just serve Oneida tribal members. We serve members of any federally recognized tribe and their descendants out here at our healthcare clinic. And the picture you see there is our current clinic. We're expanding. Our campus is hopefully expanding in the very near future because we have definitely outgrown our existing building. So next slide, please. The Oneida Nation Reservation is located within the boundaries of Brown and Outagamie counties in northeast Wisconsin. So on that map, you see the little square within the circle is where the reservation for the Oneida Nation lies. It lies on both of those counties. It covers 65,400 acres, and approximately 27,589 of those acres are tribally owned. The nation has approximately 17,272 citizens. And of that, about 7,881 enrolled members live within Brown and Outagamie counties here in Wisconsin. So an enrolled tribal member or an enrolled member means a person who has been enrolled in the tribe and whose name appears on the tribal membership roll and who meets the written criteria for membership. And that is determined by blood quantum or blood relation. So just to put that into a little bit of perspective. I shared a couple of our little graphs showing the number of tribal members by location. So the Oneida Nation has approximately 28% of its enrolled members living outside of Wisconsin. They live all over the nation. We have about 27% that live on the existing reservation boundaries in Oneida, Wisconsin. About 14% that live in remaining areas of Wisconsin. 12% of its member enrollment live down in the Milwaukee area. And then we have about 19% of the membership living off of the reservation in Brown and Outagamie counties. So they're spread out all over Wisconsin and all over the country. And then the other graph just shows kind of the Oneida enrollment by age. So when you're looking at that graph, you know, the higher numbers are the ages 30 and up, 30 to 44, and then our 15 to 29-year-old and 45 to 59-year-old population with approximately 5% age 75 and older. Next slide, please. I share with you just a little snippet of our Oneida Nation Community Health Assessment. Newer for us this year, from years past, we've done a community health assessment for many years, but our community health assessment this last cycle, we specifically targeted some of the areas around dementia and caregiving. And what is that looking like? What are the tribal members out here asking for? Or what are they seeing in their caregiving journey with their loved ones? You know, statistics tell us that 1 in 5 Native American adults age 45 and up report experiencing memory or thinking problems. And in 2002, we thought it was time to start asking those questions through that community health assessment. Through that assessment, we were able to identify that 35% of Oneida respondents indicated that they're limited in their activities due to their own physical, mental, or emotional problems. And then we were also able to identify that 13% of those respondents have health issues requiring the use of special equipment. And then an additional 23% of respondents report that they're providing regular care to a family, to a friend or a family member. So we're seeing an increase out here in the Oneida area on family caregiving, on the dementia diagnosis. And as Amber had mentioned early on, or years prior, that dementia diagnosis was a really hard sell. And the more we're bringing these experiences into the community, the more we're getting buy-in. We're hearing from community members now, they want connection to services. It's not a taboo topic anymore, which is really shown for us as the professionals and as the people reaching out and trying to reach out and provide the services, that the community is hearing us and they want the help. They want the connection to the resources. They want the assistance with the caregiving. They want the support. And I think the caregiver support is the one area that we're really trying to put more focus on out here. Our caregivers are tired. They don't know what comes next. Some days, you know, they have all they can do to keep their loved ones safe, let alone addressing their own healthcare needs. So through our community health assessment, we're really trying to hone in on where are the community members struggling, and then what do we need to do to develop programming and services around those struggles. Next slide, please. So how did VDT come to the Oneida Nation? Amber gave a little bit of that history. From our perspective, so the Oneida Nation has a grant from the Wisconsin Department of Health Services to have that tribal dementia care specialist. Early on, I want to say we were one of the 3 first tribes to have a dementia care specialist in the state, geared specifically toward tribal members. The tribal dementia care specialist went through the VDT training with Lindsey, and as the program supervisor, she came to me and she said, we need to bring this to Oneida. This program is absolutely amazing. I want you to go through it, and then we need to figure out how we can get it out here. So, we worked with Amber, and in August of 2023, we had our long-term care program staff and medical providers from the Oneida Health Center go through the Virtual Dementia Tour. We received just tremendous feedback from that. The next questions then that came were, now who gets to go through it, and how can we get more people through it, and when can we get it back? I was overwhelmed with that. So in November, we had reached out to Amber again and requested to have 2 additional social workers and a registered nurse become trained facilitators, in addition to our tribal dementia care specialist, because she had already gone through the training to become a facilitator. So we scheduled that training in February of 24. Myself and 2 additional staff were trained to become the VDT facilitators, which allowed us to then bring more of our Oneida staff through the tour. We brought part of our community health nursing team and our health promotion disease prevention team through. We have a long way to go, but we're making strides in getting those staff trained. And now that we have 4 facilitators, we anticipate making that happen much more quickly. Next slide, please. So the impact in Oneida, our public health director was one of the first to go through it. And after she had come in and talked to me about it, and I'd asked her if I could quote her, and I asked her to send me a written statement. And she said, it provided for her a real life experience for what an individual dealing with Alzheimer's faces every day. With even the most basic of tasks, such as communicating needs and wants, it was a valuable experience. And we heard that message resoundingly. We had a medical student go through it, and she was so excited about it. Her ask of me was, how do I get this to the facility that I'm doing my internship through? So there's a definite interest out there. Next slide, please. Another one of our managers that went through, her feedback was that she personally felt deeply impacted by the experience. The experience is one I will not likely forget and would be able to share what I learned with others. I felt like a real experience from it felt like a real experience from the perspective of a person with dementia, and that all of my senses were physically challenged, which in turn challenged my emotions. I felt helpless and reacted by shutting down. The VDT was a real eye-opener for me. It provided insight into how difficult life must be at times for a person with dementia, and also what I would need to consider or do better on behalf of a person with dementia in order to help keep them physically and emotionally safe. This was one of our staff members who also had a parent, and she was on that journey with her parent at the time. It very, very deeply resonated with her, and she told me on the side that it really made an impact in how she was working with her parent, from the perspective of more patience with them, taking a step back and thinking about, wow, what's going on with them? What are they seeing, thinking, feeling, touching, smelling, when all I want them to do is put their shoes on? Those simple commands or demands on a person with dementia can be perceived so very differently. And this experience really helped her to take a step back and think about what her parent heard from her and what they perceived they heard from her. So next slide, please. So the other experience, from the perspective of one of our registered nurses, who is also an enrolled tribal member, she said, the experience was eye-opening. It gave me a better understanding of the challenges someone with dementia faces every day. I was actually kind of sad to know that a loved one could live a normal, happy life and then be faced with this disorder. It makes me feel for the families, including my own, who care for a loved one who has dementia. I can understand the struggles and overwhelming processes of it all. I think this experience should be shared with everyone. It was that impactful. Next slide, please. One of our public health staff members, also an RN and community health or community tribal member, said that she felt that the VDT was instrumental in her understanding of the true impact of dementia on an individual. Before the VDT, I thought knowing the science and symptoms was sufficient for my professional role as a nurse and manager. With VDT, I quickly realized that I did not know the true impact on the individual. The VDT provided me with an experience that prevents me from taking for granted the frustration and helplessness that are part of that condition. The VDT experience gave me much more insight and compassion for my role in dealing with dementia and managing individuals who advocate for those with dementia. I highly recommend that all caregivers, health and social service professionals, and paraprofessionals participate in the VDT. Right, and then next slide, please. So this was my impact. Being a social worker, I always felt like I know what dementia is. I know what they're going through. And then I went through the VDT experience myself, and I didn't know anything. It really reshaped my perceptions, my understanding, and my feedback. When we debriefed a little bit among staff, I had said, I always felt that I had a good understanding of dementia. After experiencing the Virtual Dementia Tour, I realized I had a lot more to learn. This experience really opened my eyes to the challenges, frustrations, and feelings of a person with dementia. There's just really no way to really feel and understand what a person with dementia has to deal with every day until you go through this experience. So in our Oneida community out here, it's been very well received. People are knocking on my door and saying, hey, I heard about this. When are you bringing it back? So we've got some work to do and moving things forward. Next slide. So this is just a little snip about that I added on why did I want to become a facilitator. The impact on me of going through the experience led to me wanting to become a facilitator. So the nurse and social worker who went through the training with me to become facilitators, but I sought it out to become a facilitator because the impact was so great. As a manager in my organization, I feel it was important to have more than one facilitator to allow us to bring the tour to our community in a larger capacity. So that was the end of our training with Amber in February to become facilitators. Next slide. So what's next? As I said, we do have plans to continue to offer the virtual dementia tour to the Oneida Health Center staff. We want to bridge it out then to our behavioral health staff, our employed health nursing staff, and our nursing home community. And then once we get all of our staff in comprehensive health through, then we want to move to offer it to community members, elders, and I would love to offer it to the Oneida Nation high school students. Hearing Amber's experience with offering it in another tribal community to the youth just really resonated with me, and the need, because so many of our families are living together, multiple generations, and those youngsters need to understand what's going on with great grandma. Next slide. Next slide, please. All right. So that's kind of been our experience here in Oneida. We have some time left. I think we'll be able to entertain some questions.
Yes, thank you both for your wonderful presentations. We do have questions coming in from our participants. So as a reminder, you can feel free to enter your questions in the Q&A pod of the webinar platform, and we'll get started with some of the questions that have come in already. One of the questions was asking, if you're a local government agency and want to partner with a tribal agency to provide dementia training and services, what is a good way to initiate that outreach?
Honestly, I would connect with a tribal service provider and start there, and maybe that tribal employee or staff member can kind of help guide you.
Okay. Anything you want to add to that, Carrie?
I think that most of the counties in the state of Wisconsin have the Aging and Disability Resource Centers, and there are tribal aging and disability resource specialists. So that would probably be your best starting point. Those ADRCs at the county level know who to contact within the tribes.
Great, thank you. Okay, another question was asking for either of you, did you have to make any adaptations or changes to the VDT in order to implement it and so it was relevant for your tribal community? Amber, do you want to start?
Oh, what's that?
I was just saying, do you want to start?
Oh, sure. I did have to do some adaptation for the debriefing. There is just kind of a basic outline for that educational aspect at the end, that debrief component. So we're able to have that freedom to really kind of fill in what we feel is needed, case by case or individual by individual. There's a couple different ways that you can offer those debriefings, and one is either individual one-on-one or as a group, which I also really liked that flexibility. But I did have to add some cultural aspects to some of my debriefings.
Great, thank you. Carrie, anything that you want to add to that?
I would just back up with what Amber said, and I experienced a group debriefing when I initially went through the tour. I would honestly say I like the one-on-one better. I think that it gives an opportunity for the person who just went through to sit down and really talk about what they've seen, felt, and heard at their own pace, at their own level, and to be heard and talk through that one-on-one, because some people really struggled with their emotions afterward. Some people were great and thanked me and out the door they went, but
Mhm.
others really needed that one-on-one talk time.
Sure. That makes sense. Thanks for adding that.
Mhm.
Can you talk a little bit about the garb? There's a question about, does the garb change depending on who is being trained, or is it the same materials that are used?
Should I answer that, Carrie? Or-
Go ahead, yep.
Okay, so the garb is the same for everybody. The only time that a piece of the garb would change is if there is some kind of issue or predisposing health issue that might be exacerbated by having that garb on. So the headphones, if somebody might have issues with PTSD or sudden sounds or things like that, we would just put the headphones on without sound. If there's if they have hearing aids, we would either have them remove the hearing aids or turn them off. So there's just certain factors that would determine if you would not use a piece of the garb. Otherwise, it's the same for everybody.
Got it. Thank you.
Mhm.
So another question that came up is asking a little bit about, in Wisconsin, for the tribal dementia care specialist, who are they employed by? The state, the tribes, Glitzy, Oneida Nation? Can you talk a little bit about how that arrangement works?
Yeah, that's the Department of Health Services. That's through the state of Wisconsin. That's who the tribal dementia care specialists are funded by. But we had a partnership through my grant, so they partnered with Glitzy, and that's why we were able to offer the trainings and really get a really good relationship between us. Mhm.
And each of the tribes employs their own dementia care specialist
Mhm.
with that funding from the Department of Health Services. So the dementia care specialist in Oneida works for the Oneida Nation.
Mhm.
Great. Thank you so much. A few thank yous are coming in, just so you know. So do you have, and can you give any examples of what you saw as the most impactful part of the VDT experience? We'd love to hear from both of you about that. So Carrie, do you want to start with this one?
Sure. You know, I grew up with a great grandparent who had dementia before dementia was a thing. And there might have been a diagnosis for it. I can't remember what they called it back then, but I just remember it being a scary thing. You know, when we went to the nursing home to visit great grandma, I was terrified because I didn't understand what she was saying sometimes, or, you know, what she was trying to do. It never made sense to me. Obviously, that probably led to my career in the healthcare industry, and just learning more about working with the elderly and people with dementia or other, you know, memory loss type issues. But when I finally went through that VDT experience myself, as I said earlier, I thought I knew it all. Like, I've done my research, I've written my papers, I read up on it, I go to trainings, I go to conferences, but until my senses were impacted and I had to live my life in that time span I was given and do the tasks that I needed to do, when all of my senses were, what's the word I'm looking for? Just totally went mind blank. My senses were interfered with. Like, I didn't have the ability to see and to touch and to feel and to do, and it was frustrating. And I have all my capacities. So that really impacted me and how it internally affected me when I knew I was going to walk out of that room and have all of my capacities back. For a person with dementia or Alzheimer's, they don't get that back. That's life every day, that confusion, that unknown. It was just really a profound experience for me.
Thank you. Amber, anything you want to add?
No, that Carrie pretty much summed it up with that. The only thing I would say is a big part of that impact for me was actually seeing how the experience impacted our community members and staff members going through it. That was an amazing thing to see, that aha moment that, oh my
Mhm.
gosh, this is what they're experiencing, and then being able to talk through what it is we can do to change our way to better suit and care for our people with dementia and Alzheimer's.
Sure, thank you. So we have a question here about recruiting youth to participate. Was this made officially part of your ADPI program, Amber, or was it something you added? How did that work and how did that recruitment go?
We're talking about the one youth event or the VDT?
Yeah, the youth.
The youth event, it just was, it wasn't officially part of my ADPI. It's something that the community wanted and requested. So we fulfilled that through our ADPI grant, working with that tribal nation's tribal dementia care specialist.
Great, thank you so much.
Mm-hmm.
So we have another question. Trying to get a little more information, when you're coming from a community-based organization or from an area agency on aging, can you give any more suggestions about ways to align with or support tribal programs? Is there an openness to partnering? And what kinds of things would make these partnerships even more valuable?
I definitely think there's an openness to partnering. And I think it just comes with understanding one another and understanding intentions and things like that. So I just think starting with communication, and figuring that out is a good starting point. Carrie, I don't know if you.
Yeah, I was just reading the question. So part of what makes it really interesting here, at least for the Oneida Nation, is we are an accredited public health department, and our dementia care specialist falls under that public health department, which I think is what goes back to where I said we address dementia and Alzheimer's in our community health assessment, because we see the value of this evidence-based experience, and collecting that data and really looking at the impact of Alzheimer's and dementia in Indian country, and then developing the programs and the resources that we can bring out here to help community members to better understand what they're faced with, and then how do they move forward.
Great, thank you. Can you just mention the name of the organization again? Is it just Second Wind or Second Wind something else?
It's
People
Second
are
Wind
asking.
Dreams.
Second Wind Dreams. Okay.
Mhm.
So everyone who's asked, how can we get this into our community? You can look for Second Wind Dreams and contact them about VDT directly. And you've seen Amber and Carrie's emails up for a while. We'll just go to that last slide, Cameron, as we address a few more questions before the hour is out. One more question about working with youth and VDT. We asked about making any adaptations for your tribal communities. Did you have to make any adaptations for younger participants?
So part of delivering the virtual dementia tour, there is a hold harmless form that gets filled out. So we did adapt that to include the parent or guardian's okay for the youth to go through. As far as the experience itself, there is the opportunity to put 2 people through at a time. And we learned with the youth that just was not happening. When we had 2 of the youth in the room at one time, there's kind of horsing around and, it wasn't taken seriously. So we just kind of changed that around to only put 1 youth through at a time. And then with the debriefing, the educational part afterwards, we also offered some visual things like videos about dementia that particular tribal nation had created. And also a video that Glitzy had created through this ADPI grant. So we added that as part of the education, so it wasn't just us talking. Mm-hmm.
Great, thank you.
Mm-hmm.
Okay. Anything else that you would like to comment on before we go to our closing remarks? One more question just came in about taking the training once, or can it be done multiple times? So if you want to touch on that and then maybe add any final remarks, we will finish with that question.
Honestly, if you don't mind, Carrie, I think it should, if it's for tribal staff, I think it's very beneficial for that to happen, annually, even semi-annually. as an ongoing training for them. You know, with turnover and things like that, there's new staff coming and going, but even as just a reminder, I've been through Virtual Dementia Tour probably about 4 times now, and each time it elicits a different emotion or response from me, and a different level of understanding. So, and Carrie, I don't know if you can add to that.
Yeah, no, one of my staff, had gone through it in a previous place of employment and then went through it again here and is now a trained facilitator. And she too would say the same thing, that she found it very beneficial to go through it again and will continue to go through it.
Mhm.
Great, thank you so much. Well, I want to thank you both for your fantastic presentations today. We had a really engaged audience, and I believe that we all can tell that everyone learned a lot, and how wonderful to learn more about how we're bringing these services to tribal communities. So thank you, everyone. And if you would like to join us again, we have 2 webinar opportunities in August. The first will be August 12th, where we'll learn about innovative dementia-friendly initiatives coming out of Clark County, Nevada. And our second August webinar will be on the 27th, where we talk about cognitive stimulation therapy programs that are directly supporting people living with dementia. You'll receive registration information for both of those events in the coming weeks as we round out our registration forms, and we hope you will join us for those. So thank you again, everyone. We will sign off for now, and take care.
Thank you.
Thanks, everyone.